bit about me. Now, I've had the opportunity to build my career around being part of patient experience, being involved in improving the patient experience and that transformation. And for me, it's really been rewarding to be part of that and making a difference in the way that the patient receives care. Now, my why, I'll explain just a little story on why this is so impactful for me and why I'm passionate about the patient experience. And so a situation happened with my mom. And so to give you some background information, my mom, she was born in another country, speaks 3 languages, and English is her 3rd language. And so she had a doctor's visit coming up, and when I went to ask her how her doctor's visit went, she said, I'm not sure. She had this look on her face where she was concerned, and she said, the doctor said something was wrong with my heart. And I asked her, well, what did the doctor say? She said, I don't know. And so now this is after the patient's visit, right? And she's left scared. The doctor referred her to a cardiologist, and she doesn't know why. So it's an uninformed patient. And for me, when I heard that, I wanted to make sure that as I'm part of improving the patient experience, that something like that doesn't occur. It gets addressed, right? Because the patient at the end of the day is someone's mother, father, brother, sister, nana, or pop-pop. And so making sure that we do provide them with excellent patient experience and care, it's really important. The last 2 sessions, I'll be talking about really the patient experience, the patient's voice, engaging in communication with the patient as well. So session 10, the Patient and Family Advisory Council, also known as PFAC. And for this one, we have 2 objectives. They're listed there, understanding PFAC, and then also understanding how we capture the PFAC data to incorporate in the care delivery. Really quick, if you could take the pre-survey, just rate your level of knowledge from 1 to 5 on those 3 topics there regarding PFAC. And just a show of hands really quick, does anybody have a PFAC already established? Okay, good. Okay, so I'll remember you guys when we go into the breakout session, and I hope that you can share your experiences. But for PFAC, again, like Dr. Happ mentioned earlier, it's really bringing key stakeholders, the patient family member, and practice staff together in a casual setting, typically like a meeting setting, and eliciting information from the patients to understand how their experience went. And so why is this important? So it's important because PFAC it builds and fosters that patient-centered care. It's also has been identified as a best practice in care transformation towards patient-centered models of care. In addition to that, it allows the practice to obtain feedback on the experiences from the patient and family member perspective. It also helps to build a relationship with the patient and the patient's family members. And then an opportunity to gain insights on the strengths, and then also areas of opportunity to improve on the way that the care is being delivered to the patient. Okay, as far as the MDPCP requirement, it is to convene a PFAC at least annually, and then also integrate those recommendations that you capture from the PFAC into care as appropriate. Right, so we talked about what PFAC is, why it's important, and now also the MDPCP requirement. So we'll jump into the PFAC framework, and this is really high level showing steps on how to establish the PFAC and obtain the data and information and incorporating it into care delivery. So we'll walk through the next couple of slides each step. So the first one is establish and maintain a PFAC. So I think for this one, when you're looking at your practice, you want to identify a patient experience or patient champion that will lead and coordinate this PFAC effort. So once you identify that patient, then what they will have to do is really establish a scope for the PFAC. And this is defining the logistics of what the PFAC is going to accomplish. So it's looking at things like setting the mission and vision, setting goals and objectives for what the PFAC wants to accomplish within the meeting structure, the meeting frequency, where the meeting is going to take place. And this is similar to how like a project charter or like a meeting charter would be outlined. So after that is defined, then you want to recruit. So you're recruiting internal staff to be part of the PFAC, and then you're also recruiting the patients to be part of the PFAC as well. So when you're recruiting internal staff, it is good to have both administrative staff and also clinicians involved as well. For recruitment of the patients, what would be good to do is establish a criteria of the ideal patient that you would like to participate in the PFAC. And so using things like the demographic information, so you want to make sure that you identify the key demographics of patients that are being seen within the practice. So if there's a majority of a certain demographic population being seen there, definitely want to add that to the criteria list when you're picking the patients. Another thing to add is identifying the skills and abilities that you would need the patient to have in order to participate with the PFAC as well. And we'll get into that in a little bit. But after you really define that criteria for selecting the best patient to participate in the PFAC, then you might want to come up with a process where it's an application that the patient will fill out, capturing that demographic information or the criteria that you need for the patient. Or also, in addition to the application, you want to interview the patients. And when you interview the patient, that's where you can really identify the skills and abilities that the patient may have that you're looking for. I think also part of recruitment process as well is asking the practice staff. They may have someone that would be a good fit or someone in mind that they think would be a good fit to participate in the PFAC. All right, so talking really quick about a patient, and these are just recommendations on things that you could look for with like skills and abilities that you would try to vet through the patient before recruiting them to be part of the PFAC. So looking at Miss Anexa's personality. So again, she's extrovert, enjoys group meetings, and then she also engages with her peers and encourages them through life challenges. Still dancing here. All right, so just looking at that personality profile, she would be a really good candidate for our HealthLinks primary care practice PFAC. So she has the skills and abilities where she shares information about her experiences that others can learn. That's that extroverted personality that she has. And she's also able to see beyond her own personal experience. So this is really important, I think, because I've seen patients that they've had a really bad experience and they just really want to dwell on their experience and they only want to talk about their experience. But it's important that the person that you recruit, they don't do that and they're able to listen to other patients and see beyond their own personal experience. Shows concern for more than one issue, and then collaborates and listens with others, and then wants to make a difference. So these qualities and skills, depending on how you develop that application for the patient to fill out, you could capture this information, but then it's also with the interview process that you could see if these skills and if the patient has these skills and abilities to be able to recruit for the PFAC. All right, so for step 2, and this is making effective use of the PFAC meeting. So making sure that an agenda is developed and that meeting minutes are captured throughout the meeting. Because at the end of the day, when you are meeting, it's really qualitative data collecting where you're obtaining the experiences of the patient, and you're obtaining the patient's voices. And once you get that information all documented, if you have a data analyst or if it is that person that's leading the effort, they can take a look at that information and kind of identify if there are any themes. Those are certain areas that we can pinpoint to develop a improvement process and develop and incorporate that into the care delivery. So examples of PFAC topics, they include those listed there, patient safety and experience, marketing and physical design, and also the communication that's being used between the patient and the practice staff. All right, so step 3. So this is communication. So it's really important to communicate the changes and what's being implemented from the PFAC internally within the organization, because there's a lot of work that goes on with implementing improvements or trying to transform. And so this is a really good way to highlight all of that hard work that's being done. And then it's also important to communicate that to patients as well, because if you communicate it to patients, it's really building that patient-centered care, because it shows that you really do care about the patient and you're trying to make those changes to the way that they're receiving delivery of care. Now, really leveraging the PFAC as well on how to communicate these changes is important. There may be ways that you already communicate with the patients through your office, but getting ideas from the PFAC members on how to communicate the changes would be a good way to just leverage that as well. Right. And then the last step, so reviewing the data to inform areas to improve the patient experience. So I think this is also in line with step 2, because you can look at health utilization, outcomes data, also the patient experience data, and when you look at that information, that can help to identify or form the agenda for the meeting. If there's something in particular that you see with the data, then you can put that on the agenda and kind of dig through that, because most of the times that's quantitative data, so you're looking at numbers, but if you see there's an issue, then you can really get that qualitative data for the patient's experience, where they can actually go into detail about and maybe explain why that number looks the way that it does. That, and then also when you do implement any type of initiatives, you want to make sure you measure and then also assess the improvements and how the changes have impacted. So great way to use a Plan, Do, Study, Act model here if you do identify an area that you want to improve, and also communicating that improvement and that change back to the PFAC members helps them to understand that their voice is valued and they are being heard. Okay, so I know that a couple of people raised their hands. So could you please share your experience with PFAC, whether it's, have you implemented any improvements, or if you've been a part of PFAC and what that looks like?
And it worked really well. So I learned things from them, and then we also really tried to learn as much as we can about having counsel before we did it. But what I did first with my classes was gave them a resource finder and educate them on really what is feedback, how it's been done before, what the purpose was, and then show them some resources they can use. So then they chose, how many people they a little sudden of the things that they would need to do first. The first thing was we decided on a date and the time we wanted to do it. We decided to hold it for 1 hour. We tried to get, and then they would get participants. And they tried to think about what would be the best timing for our participants. If it was just Medicare patients, some of them don't want to have certain times that would be more available. They didn't like traffic, or they hadn't considered transportation. They wanted to have someone else who wasn't, and might have to wait for to work out. So they considered that, picked the patients, all the patients, invited them, and then they sent a letter. They might go and write a letter. So they sent a letter to them, wanted to help them take this time. And then we just sort of made a packet of things that they could use, paperwork, a sign-in sheet with their name and phone number, making sure school by the next time. We did an agenda, and we made it quite simple, and we put down like who would welcome them if the physician wanted our physician popular and said hi, thank you for coming, and then just left it. The office manager actually was, I know you said that maybe you get patients. They actually had the office manager do it, because that way it facilitates the whole feedback. But they didn't have to participate necessarily that much in the session, be there, and be visible. And then they signed in, because it's sort of confidentiality agreement, we thought it was a good idea, because they just signed that we don't want to share information here, there, on the email, and if you're not, we don't share anything, so we have this type of confidentiality. Then they participated, and at the end, then we have a scribe. Person, someone to ask questions, and to be described, and at the end, we did a really simple questionnaire, just ask them, what do you think of the location and time? What did you think that we explained what feedback was? Well, did you have your voice heard? And then are you excited about coming to the next one and willing to participate? And then we just did the minutes afterwards. So anyway, that was a lot. Thank
you.
So, did you have this kind of outline of the sessions you did? Okay, and you can send it to the practice coaches and states also tonight so people get to see some of the ideas you had. Did I understand that the PFAC had patients that were not just here?
Well, we first realized that there's we should look at the whole policy, and just like we were going to do check the quality of the whole practice in everyone. So they thought, well, we could invite, this is their Medicare patients, and they have other patients too. So they thought about the demographic and wanted to try to get inside the everyone.
And that's great because Dr. Hammond talked about during his presentation saying, we're hoping that this is transforming your entire practice. So the fact that you have a feedback and you did include patients that were just not Medicare, but also other patient populations.
The next thing too, practice happen. One of my practices that wants to do this, is that we're really concerned about one issue in our practice. We want to focus on that. They feel that that's important to focus on. Well, the one that we just did, generally asked them just several things. We asked them, what do you think works really well? What do you think there are opportunities for us to fix? And why do you stay with this practice? And that's what we asked them, and they were just eager to hear.
I can tell you were listening to it.
So the nice thing is, well, when you were talking about PDFA, the lovely thing is to want to do an intervention, and so that just segues straight into let's do an initiative.
Thank you for sharing. I just really want to touch on that. It's for the PFAC information. There's no magic number on the amount of recruits that you need. It all just it's based on how you want to design it, and you can start out small and gradually grow and add patients to the PFAC as you see fit. Really quick before, because I think, yes, session recap. One of the things that I wanted to share as well, it was part of the pre-survey, and one of the topics that we need to discuss is how to identify that information from the PFAC and then also incorporate it into like care delivery. So I wanted to share some examples of how, and what I've seen in my experience on how information was collected from a PFAC and a practice was able to implement that into their care delivery. So and something as simple as, Dr. Happ mentioned, the magazines and looking at the waiting room and what the waiting room has. I know that, magazines come up a lot, but there was also what was shown on the TV screen. And then I know that when we were talking about those social determinants and those pamphlets, that would be a really good way to have that out as well, just to give patients information if there's any type of diabetic information or pamphlets in the waiting room as well. I know that there's been some patients where they felt that the waiting room wasn't as homey, so they recommended maybe putting a plant or changing the paint on the wall. So it's things like that. And I think the other one that I wanted to leave off with is marketing materials too. So I've seen a practice where they brought in the letters or whatever scripting that was being used to outreach to the patients to get them into care or remind them. And the PFAC members were able to take a look at that and say, well, you know what, my health literacy isn't this high. I don't really understand what this letter is asking me to do. So the practice was able to look at that, take that feedback, and revise their marketing materials as well. So just a couple examples of how helpful that PFAC information can be when you're improving the patient's care.
We got together and we spoke to you and I think that was super helpful when we constructed the binder. And one of the slides was put in the binder is that we took up, like Amy has a great article from PFAC as well as what we got from MVPCP. And it took a while to kind of get to that sweet spot because we went to our legal department and our confidentiality. We actually talked to our coach who might have to respond. We can be used as much more user friendly, so you're trying to get that groundwork that that's how we did the pilot and what the other practices and tried this out, and then put the binder together. So we did 18, we have 18 our CTOs practices, so we created binders for each one of them, so that way the care managers have a place to put it and to reference, and they feel like it's official, it's just feedback on the front, and everything's done like that. It makes you feel like the CTOs are really guiding them. Yes. And then they feel like, wow, this is where I go, this is where my content is, and it was in the order of everything that we had done. And it just keeps it organized.
And that's a great idea. We also do the same thing, we provide a testing, because, you know, your active practice is supposed to meet you, patient. Not everybody welcomes feedback.
Yes.
And it's as easy as meeting in the waiting room. I always tell the practice, again, sometimes as a practice manager, it's best when you walk into a practice with one dog, rather than for you, right? Because you never know what the patient is seeing. And so you get the best feedback. How can you ask the patient and see exactly what they see? We then look at the staff, and we walk into your practice, so we look how it looks. This is the best feedback you can get. So what we did was actually, you know, having the practice managers, give them a chance to patient agenda, a good idea. You don't know what to talk about in the feedback and community. Because you guys will present the suggestion box. Put that suggestion box out, put them in that spot, and patient walks through. Let them write, look at this, every week, take the 5 parts that I looked at, put it down, through the model, we model our practice with them. So we kind of a compiling questions that came up with the suggestion box. And then I did the same on the agenda. Because there will be multiple companies or ideas, evaluate comments to keep on following the practice, and then use that to most of our 6,000 have been doing together. Feedback management, but it was a great feedback for some of them.
You asked them on the card if they would like to participate in maybe the practice one time and would they be on the
No, so come up here.
No,
I was not at all mind at the time.
the basic, whether it's okay. I was thinking if in council, that might be an opportunity to say, would you be willing in the future, but one of you like take an RPO and advise the council, their issues like maybe one.
The one idea I thought that you did was the inclusion of other payers, because I think insurance payers, that is a great, honestly, a great tool to activate, not just from the Medicare perspective, but from other, you know, because insurance payers well, and the other money as well. So that's a good one to take that to those practices for your idea. But at the same time, you know, there's a special part of great feedback from some of our doctors. We get, you know, you don't really know what your patients are feeling unless you ask the question.
So Chad, I think you will be super happy to get what you're hearing now because often enough you can think that the CTOs have this rivalry relationship. So when you see them actually brainstorming and sharing, yeah.
And it was also the feedback you got. Yeah. So one really quick thing, and we'll move on to the next session. Incentivizing as well could be something, an idea if you want to subsidize maybe transportation or provide them with snacks as well that can help create that environment where it's collaborating. They don't feel threatened and they feel like they can open up about anything, whether it's good, bad, ugly. But those little things and details really make a difference on the experience of how the PFAC members are going to have with the meeting. So session recap, that's 3 of them listed there now. And thank you guys for staying and actually participating.